lot of protein, there's water.
Dawn Roten of Kent,
Some of the stuff I can't have anyway, but it's in here.
Was on a transplant list waiting for a kidney.
I was really anxious.
She waited an unusually long time.
Feet flat on the ground, no talking, no moving.
My name should have been on the list in 2016 instead of 2021. Let me get my cane. Can't forget the cane.
One of the reasons for the delay in getting on the list, she's Black. Until last year, race was a factor in calculating who got on the kidney transplant list and when. There was a stereotype in science that Black people have greater muscle mass than white people. That bias led to the erroneous assumption that Black patients had stronger kidneys, leading to longer wait times.
That was, in retrospect, wrong.
Dr. Nikolai Leka is a UW Medicine kidney specialist.
First of all, having race, which is social construct, and is not necessarily reflecting the biology of the patient in front of you, has nothing to do with actually how much muscle mass someone has.
Medical students at the University of Washington were some of the first to flag the misconception. That led to a big change in 2021, with national transplant organizations admitting racial bias was leading to health disparities and inequities. And from now on, the medical field would use a race-free approach. Right now, within UW Medicine's network, there are around 450 patients on the kidney transplant list. Of the 450, 50 patients are Black. Once race was removed from the kidney health equation, 30 of those patients received a revision in their timeline and received shorter wait times. Now, these may sound like numbers, but we're talking about real people desperately waiting for life-changing procedures. Glenda Roberts of Woodinville was told her kidney was failing in 2006.
It was not easy.
She too didn't end up on the transplant list because of her race.
The reality of the outcome was that African Americans were on the list for longer.
She was sick before the calculation change. She had to wait so long and got so sick, she was forced to go on dialysis.
If I got to the point that I could be on the transplant list in 2009, and it took 2 years longer because we were using this flawed equation, that means they would have started the evaluation in 2007.
After 4 years of waiting, in December of 2010, she finally got a kidney.
How are you?
I'm fantastic. I'm better than fantastic.
And the kidney's serving you well?
The kidney is doing great.
After her transplant, her life went back on track. For the first time ever, she started running half marathons. Roberts also took on another challenge. She started working as a patient advocate at the University of Washington and sat on the task force to remove racial bias from the kidney health equation. Change didn't come easy.
We worked on this for a year. They thought it would take us 6 months. If you have people who are researchers and their livelihood is based on the research and the publications that they have, for many of them it was difficult to accept that maybe the data was wrong.
As a result of the change, in the first few months of 2023, nationwide, 14,300 Black patients had their wait times for a kidney cut by an average of 2 years.
This one is vitamins.
One of those patients was Dawn Roten.
This one is magnesium.
The patient from Kent who waited for a healthy kidney for 3 years.
I'm happy. It's like more freedom and I don't have to worry about anything, It's gonna be easier.
Day by day, the number of pills she needs to take will shrink, and she hopes the number of Black patients on the transplant list will too.
What do you have to say to all the other folks on the transplant list who are waiting?
I hope they get moved up so they get a kidney soon too.
For Facing Race, Sharon Yu, King 5 News.